Thank you very much to colleagues, and thank you for the opportunity. In relation to the crew change, I think Nana did justice to what the country is doing, so I will not mention that. But let me say what Ghana did, which is of best practice, is that immediately the WHO declared the disease as a pandemic. The port of entry, especially Tema Port, began to hold multi-sectorial meetings to look at certain things that needed to be put in place. And there was the need for a multi-sectorial approach to establish a committee. And this committee included all stakeholders working at the port. Apart from that, we decided to also ensure that we at least give training to all the staff working here, especially on the disease. So what we did was that people working at the port here were given at least the definition of COVID-19 and were taken through the preventive measures. Over 60,000 workers at the Tema port were taken through from one state to the other. Fortunately for Ghana here, the seaport, we take care of it as well, not only those at the other port. So the seafarers at the seaport were equally taken through the case definition of COVID-19, and the committee put up contingency plans. And these contingency plans was to look at all the contingency plans that were existing in the port, because we have already some plans in place. So we needed to bring all these plans together, some sort of synerging the points of entry plans and ensuring that the plan for addressing COVID-19 issues were in sync with everybody. Now, there was also the need to identify the role of the ship operators, which is very key. And we brought them on board by ensuring that they should liaise with the port health team and the vessel teams. What this meant is that the COVID-19 team at the point of entry, that's the Tema port, was always to be liaised with the vessel operators. So if there was any issue on board the vessel, they needed to notify us so that we prepare appropriately. Why they needed to do this was to ensure that we get information ahead of time to be able to respond to the disease. As a result of this, vessel operators were made to ensure that vessels entering into the waters of Ghana were notified 48 hours to 72 hours before they entered into the country. What this meant is that the COVID-19 team was of the known that a vessel was entering into the Tema port at least 48 hours. And then they must first give certain information. One, the last 10 points of call. Second, the crew members on board. And third, any health risk on board this vessel. This was needed because first we needed to ensure that we did what we call risk assessment of the vessel entering into the country. Then we will know the type of disease or anything that needed to be done for us to prepare on ground before the vessel entered. Now, when there is a health issue on board after the port health officials have entered the vessel, what we were doing was that until recently, all the vessels were to berth at the quarantine anchorage, and that is where screening was being done. So all the health issues were attended to at the quarantine anchorage, which was 3 to 4 nautical miles away from the shore. And then anybody with any health risk or any of the signs of COVID were isolated, either sent to the Tema General Hospital or the port clinic for second assessment. And if there was the need for them to be transferred to the Legon Hospital, which was identified as the treatment center for COVID-19 in the country, then the person was sent in there. So this was what was going on. The next issue, which I would say was one of the best practices, was that we ensured that we did what we call risk-based approach. This risk-based approach was to look at the type of cargo that was coming into the country, the number and nationality that was coming into the country, then the country's epidemiological profile, where the vessel was coming from. Is the WHO saying they had more cases or what? This will inform us to know what to do even before we get on board the vessel. So this was some of the practices we were putting in place. Then on screening, we were always advising the crew members and the vessel operators to have a specific area where we did interview and medical examination on board the vessel. Granted that there is any suspected case, we gave the option. There is a hotel here at Tema, which we have considered as a quarantine hotel, or within the vessel, a place where you can do an quarantine for the next 14 days. This is what we have been doing till date. And most of the vessel operators are very happy with this type of approach, because some of them will rather prefer that we quarantine them on board the vessel for the next 14 days as we monitor them. Now, the other good thing I want to mention is about taking them to the hospitals. At least there were some instances where we had a vessel, a ship, which was a fishing vessel, somewhere in May that entered. We realized that 8 of them were showing signs and symptoms. Unfortunately, only 1 was positive. The rest were all negative. But we quarantined the 7 on board the vessel, and the other one who was positive was taken to the Legon hospital. So when it comes to the crew change, I think Nana did a very wonderful job by explaining what we have been doing. Now there are protocols. They go through screening, and then if you come with PCR test, you are changed. But within that, you still have the 72 hours for us to monitor before you finally either exit or move on. So these are some of the practices we have been putting in place. Now, out of that, the outcome of this activity is that Ghana, at this port, at the Tema port, we have data on all vessels that have entered into the country from the day the country declared that we are experiencing COVID, so we should take note. We have this weekly data analysis with the Public Health Directorate at the Ministry of Health, and we discuss information right from here and the way forward. Second, the last one is that we submit vessel reports and crew change report to the in-country Public Health Directorate and the in-country surveillance team, so that if anybody is even entering into the country and have already entered, they can be able to monitor and get close to the person for any appropriate contact tracing should there need be. So these are some of the practices we are putting on in Ghana. And I will send an outcome to you after the presentation on data specific, what we've been able to do since January to date, number of vessels that have entered, number of crew that have been screened, those with suspected cases, and those who have been declared negative, and the way forward. Thank you very much for this.